In the president's first 100 days, he and Speaker Paul Ryan failed to get an Obamacare repeal and replacement.
I know, we're still waiting to see how some of that shows up, but we have CCM Medical segment star Dr. Jeff Barke, who joins us now to discuss the intersection of politics and medicine. Is there any hope for repeal and replace, or do you think Obamacare will take over?
Well, good morning, Mary and Derek. Thank you for having me this morning.
Thank you.
Yes, there is hope. Now, I'm happy to say that President Obama's first 100 days, we did not pass, fortunately, the disaster that was put forward by Speaker Paul Ryan. And now we see being put forward, with the help of the Freedom Caucus, a bill that will give states the opportunity to opt out of many of the Obamacare mandates for insurance. And I think that's an excellent way forward.
But is it enough to bring on board? You've got some of the conservatives there, but now you have some of the middle of the roaders, moderates who are still not on board.
Well, I agree, and that's part of the problem, because as we discussed the last time I was here, I think we're really asking the wrong question. The question we should be asking is, how did the federal government come to control healthcare in the United States? You know, it's funny, I was visiting with my brother, Ron Barke, who is an eye surgeon in Dallas, Texas last week, and we were talking about vision correction surgery that he performs. He shared with me that over the last several years, vision correction surgery cost has gone down, quality has increased because of innovation, and as a result, there is greater access to those that want the procedure. You see, there isn't a free market in healthcare. When you expose healthcare to the free market, you get what the right and the left both desire. That is lower cost, higher quality, and greater access. That's what's missing in healthcare today.
Well, and I noticed too, even for my clients, I can negotiate a lower rate for cash, which is always really interesting to me too.
Yes.
And so how does that play into how insurance works? And I know they've been looking at some of the legislation, and I just don't know how that's going to affect what we're doing in each state or within the federal government.
Well, I agree, and when we look at health care, different than insurance, but when we look at the cost of health care that is outside of the insurance market, we see exactly what free market competition can do. What is that? It lowers costs, it improves quality, and it improves access to all.
So let me understand what you're saying. So you're taking your brother's example in one narrow field of healthcare and suggesting that that would transfer throughout healthcare, because isn't the issue that lower cost will not help people who are making less than the minimum wage and who don't have a job? They still have no insurance, regardless if it was half the cost. They don't have insurance.
That's right, Derek, and there's a difference between insurance and healthcare. So healthcare is actually going to the doctor and getting that care delivered, and there are multiple options for that, especially when we eliminate insurance. What insurance ought to be is what insurance was originally designed to do. What is that? Prevent financial disaster for unforeseen medical emergency. Your appendix explodes, or you get into a car crash and you end up in the ICU. That's what insurance should cover. The way we talk about insurance today is not that type of insurance, but it's prepaid medical care, and I think that's where the problem lies. Healthcare is different than insurance. When we have a robust, market competition-driven healthcare system, we will see access to many, many more, reduced cost, and increased quality, and that's what we all want.
And I see what you're saying as far as medical care is different from insurance, because people use ERs and
that's right.
systems that are not.
But they do that
best.
because they don't have access to health care otherwise.
That's true,
right?
but I have to actually say that I think the middle class, the self-employed middle class, I think will use the ER as much as any other group. And I think statistically they do use the ERs more.
They do absolutely. And if we want universal, complete access, single payer plan for all we have to do is look at an example of that, and you tell me if that's what you want for the nation. We have the VA healthcare system, which is a disaster. My brother-in-law, who served in the Army, can access the VA healthcare system. He chooses not to because it's terrible. Instead, he uses his private insurance to get access to care because the VA healthcare system is a disaster. We don't want that for the population. We want a free market competition system that allows everybody to access care at a reasonable price with a higher quality.
And there's where I wish we had more time on that, because that's the issue, right? Well, I have clients that are physicians and their positions range across the board, but one of the issues is that if we have the free market system you're talking about, the better doctors go and provide care to those who can afford it. The next level of doctors to those people who can afford it, and what you get at the bottom of the barrel are physicians who are treating people because they can't go anywhere else, and it isn't quality care. You get hacks that are...
No, but it's also contracting, I think, too, because however we are setting up the IPA system, the groups and the HMO insurance and that sort of thing, that's where you access, that's where you have to access your care. So you will be limited to your choices, but you will still be able to get care. That's what's happening now.
That's right. And the reality is, your concern, I understand, and many have that concern, Derek, but the reality of how that translates into the healthcare system is not correct.
Right.
So we have systems like the Shriner healthcare system that provides free care to kids with cancer. We have the City of Hope right here in Duarte, California, that provides care for free to those that can't afford it.
That's because we have
High
a lot
quality.
of donations.
We
have
do.
Great fundraising for those organizations.
Yes.
But you've got to come back and talk about this some more.
Would love to. The private market works when we allow it to function.
All right.
Absolutely.
Well, up next, there will be music here in the air at CCN Arts with Anne-Marie Villicana.
That's right. Her guest, Susan Pascal, brings a string quartet of children to play. The little people are going to play next.
Your journey